That was the counter, I mean, the brand is in where it is that. So, going
I will start the class. You can talk. Harihi Om. Guru Brahma, Guru Vishnu, Guru Deva Maheshwara, Guru Sakshat Parabrahma Tasmai Sri Gurave Namaha. Namaskaram, Master. Jnananandamayan Devam Nirmala Spatikartam Adharam Sabha Vidyanam Hayagrivam Tasmahe Hayagriva 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 Vediyogade Tasya Nisara Devane Jannukanya Prabhavatu Om Shanti Shanti Shanti. My salutations at the lotus feet of Dr. Hanuman of the weekend and other Homeo legendaries, and my pronouns to all the participants of this class. I'm very glad to invite you all to the 18th class of juniors. And Friday there will be no class because of the festival. Tomorrow there will be seniors class. Friday there is no class. The table is not down. And we will continue the classes as far as possible, avoiding the holidays. But festivals and other things are compulsory. Hence we are giving like that holidays. So now today we will discuss another medicine, very important medicine. Okay, just 2 minutes. Okay, we'll start the class. Today's class is Natrum muriatica. NATRUM MURIA TICUA. Nagaraj sir is there? Hello. Is it audible now?
Yes, uncle. I am able to hear you properly.
Yes, sir.
Yes. Nagaraj sir is there?
Nagraj sir, are you there today?
Satyana,
Let me check.
you type it.
Umesh. Uncle Nagraj sir did not join today.
You can type it.
Sorry?
Type the notes.
Okay, sure.
One of you please take the responsibility.
Okay, I'll do it.
Natrum muriaticum. NATRUM MURIATICUM. Natrum muriaticum. This is from mineral kingdom. This is from mineral kingdom. sodium chloride, common salt which we use in our kitchen. This is common salt which is used in kitchen.
Can you repeat that, uncle? Sodium chloride?
Common salt that is used in kitchen, cooking purpose. Common, we are using salt, no?
Mhm.
Salt, sodium chloride. This medicine is prepared from the sodium chloride, common salt is in kitchen for cooking purpose. What do you understand by common salt? Every day we use salt. Salt, we use it for what purpose? Items. Is it not? Without salt, there will be no taste. But that salt is a medicine we are adding. Any medicine to be taken in a very minimum quantity. Medicines cannot be taken in large quantities. So salt also, what we use is very minimum. So per head per day, we can take 2.5 grams of salt. That you note down. Per head per day, on an average, per head per day, on an average, we can take 2.5 grams. That is 75 grams per month per person. So in a house, if there are 4 members, 300 grams per month. That means 1 kg salt packet should come minimum for 1 month, 3 months. But what we are doing? We are taking 2 salt packets per month. So we are consuming too much salt. Besides this we take pickles. That is annual pickles. We prepare some pickles for 1 year. There lot of salt is added. And besides that, we take snacks, fried items. Salt is added. That is all additional. Everything put together, our salt intake can be around 2.5 grams per day. Then we will have health. So salt is a must for the body to maintain the water in the body. Salt is a must. At the same time, salt cannot be taken in large quantities. Should be always minimal. Okay. Next point. The patient skin is shining. Patient skin is shining. Pale, P-A-L-E, pale, waxy, W-A-X-Y, waxy, looks as if greased or oily, looks as if greased or oily. Anemic, A-N-A-E-M-I-C, anemic, A-N-A-E-M-I-C. Anemic is bloodlessness. Anemic, emaciated, E-M-A-C-I-A-T-E-D. Emaciated means very lean. Emaciated. Then weak, W-E-A-K. Weak. and itching. ITCHING. Skin will be, there will be itching. It's not a must compulsory symptom, but natriuretic patient will have itching like sulfur. So, on seeing the patient himself, we have to find out the medicine. What are the qualities of natriuretic? Skin is shining as if oil is applied or grease is applied. I remember one case where the patient has come for piles complaint. When we have seen the face of that woman, the oil is simply coming down from the face. So we gave Natramure 30, piles are cured. It is a wonderful medicine. Any type of even chronic problems can be solved with Natramure if symptoms tally. Always the totality of symptoms is the guide for us. It is a very important point. We should always follow the totality of symptoms. Okay. Next point. Patient is nervous. NERVOUS. Nervous, irritable. IRRITABLE. Irritable, sad, 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 a kind of hysterical condition, a kind of hysterical condition of mind and body, a kind of hysterical condition of mind and body, weeping and laughing, MYS, hysterical, MIS, MYS. Okay. Weeping and laughing alternatively. WEEPING. Weeping and laughing alternatively. This is again, I'm seeing the patient when the patient is talking to you. He will be very emotional sometimes. Patient weeps. In pulsatile also, we said patient is emotional. They weep. And irritable. Very sad. Waxy face, greasy face. No hope. Sad means no hope. Hysterical condition means he will behave like a mental case. Insane person. That behavior you can observe. You can see some people, they behave in a very, very insane condition. They are not having sound mind. And body also hysterical. A type of, a kind of, it is not actually insanity or mental, but a kind of insanity. And they are also irritable. And they are very nervous. You can see some people, they can't talk properly. They feel very nervous. They can't address the gathering. They can't talk to new persons. Natriuretic is like that. Okay. Next point. Grief, GRIEF. Grief. Grief, GRIEF. Grief over nothing. Grief over nothing. What is grief? Grief is something, we call it in Telugu as digulu. Feeling very bad for having lost something like that. Sorrow, it is not exactly sorrow. Grief is worrying something on which is lost, which is not there, worrying about it. That is called grief. And the grief continues for years together. Suppose some near and dear, the patient might have lost either father or mother, dukkha, we can say. Patient might have lost either father or mother some years ago. Still he will be weeping, weeping, weeping. Because somebody comes and talks to them, you know, I lost my father 20 years back. 20 years back, gone. But still he feels that is called grief. And sometimes this fellow has grief over nothing, not a serious matter at all. But he feels there is grief, very bad, lost something. Okay, next. Consolation. 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 Aggravate. Consolation aggravates the complaints. He doesn't want to be consoled. Suppose he is having grief, he is in a very bad mood, sad mood. He will go and try to console him. Don't worry, your father already gone. 20 years, why do you worry now? Then he will get irritable. He will shout at you. What is there? What do you know, my father? I have lost him. It is for me only. Lost, not for you. He is not your father. He is my father. He will shout like that. So, never try to console a natramir patient. Pulsatilla likes consolation. Pulsatilla you can console. He will be very glad. Somebody comes and consoles him. He feels happy. But natramir doesn't want any consolation. Okay. Next. Irritable and laughing at undesirable times. Irritable and laughing at undesirable times. Actually, he need not become irritable for small things, but he will become irritable. And there is no joke or something like that. Happy mood is not there. They will laugh. That will lead to a lot of misunderstandings with an entrepreneur. But if you know that he is an entrepreneur, then you will understand. Okay, and you not bother about it. Misunderstanding will come only when you don't know that he is a patient. When you know that he is a patient, you can understand. Okay. Next. Weak memory. WEAK. Weak memory. Or you can write ROR. Extremely forgetful. Extremely forgetful. He forgets many things. He'll keep somewhere the pen. He will wait for it. He will search for it. Extremely forgetful. If the house lady is an entrepreneur, then either she will put salt in the put 2 times, or she will not put salt at all. She might have put once, but she forgets. Again she puts. Extremely forgetful. That is one symptom of entrepreneur. Next. Poor in mathematics. People who are poor in mathematics. There is another drug is Beretakar. Beretakar also poor in mathematics. They can't calculate very fast. They can't comprehend many things at a time. Argentine become reverse. They will do 4 things at a time. But this fellow cannot do at a time 2 things. So poor in mathematics. Next. Tendency to make mistakes. Tendency to make mistakes in speaking and writing. Tendency to make mistakes in speaking and writing. So, how many marks he will get in mathematics? In examination, because he will make so many mistakes. Spellings, he will put that word here, this word there, that letter here, this letter there. So you will lose the marks. And forgetful also. Memory is weak. So it is difficult for him to, and poor in mathematics also. Okay. Next. cannot concentrate. Cannot concentrate. Lack of concentration. Next, forgets what he is going to say. Forgets what he is going to say. So he wants to tell something, but by the time he opens the discussion, he will forget. If these persons are lecturers or some lawyers or something, they will just forget what they are going to say. After some time, they will remember. But by that time, damage is already done. This is a symptom of mental health. Okay. Next, constant recurrence of unpleasant things. Recurrence or remembering. Recurrence or remembering unpleasant things. Unnecessary things he will remember. That will make him brood over it. And that will lead him to sadness. Next, unable to control emotions and affections. AFFECTIONS. And falls in love with and continuation. And falls in love with other persons. One example I will tell you. You will understand by knowing the example. There is one lady or girl in a house. They have one portion to give rent. And somebody has joined in the house. That lady, person who joined them, is very, very tough lady. Very tough lady. She always scolds husband. And she is an Akswamika. And that poor fellow is a Palsatila. He always suffers because of her. And at the same time, he cannot say no, he cannot do anything, he cannot rectify her. This is the situation. And the owner, that is our Netamur patient, is there as a daughter of the owner. She will be observing his fate. And she will be imagining that if I get married to marry him, if I can make him happy, it will be very nice. At least he will be out of the problem with that wife. She will think like that. And she will start imagining as if she married him. Entrepreneur patient always falls in love with married persons. That too, where there is a problem with it. Another example I will tell you. Master E.K. sir has cured one case in Geneva or somewhere foreign country. There was around a aged woman, 60 or 70 years. There, she fell in love with another person out of only the compassion. Not love means not real love. And she's not able to come out of that. Master Ike gave her netromure in high potency and she was cured. And a girl is going to college every day by rickshaw. In olden days, there were no autos, only rickshaws are there. The rickshaw puller is a very poor man. She will be going by that rickshaw. By the time they reach the college from the house, it will be some 15-20 minutes. And in 20 minutes, she will fall in love with him and she will imagine as if she has married him. And if she is a well-to-do lady, so if she marries him, he will be out of those problems. It is sheerly out of compassion, not love, real love, out of emotions. That is nature. So Netramure, you can note down again, falls in love with married people. Note down, Netramure falls in love with married persons. Next. It is both women or men. A man also may fall in love with the neighbor who is harassed by the husband. So he feels that if I marry her, she will be out of the problem. Like that she thinks. Okay. Next point. Depressed. Homesickness. We found the homesickness in Rheoria and also in Nettle. Homesickness. Too much attached to near and dear. Too much attached to near and dear. So this is one important symptom of Nettle. Okay. Next. Poets. You will find Nettle in poets, artists, singers, painters. Very imaginative, very classical, and very good in selection. Taste is very nice. Lycopodium, I was telling that there are surgeons, judges, you will find more Lycopodium. Here, Ignatia Netramure, you will find more in singers, poets, drawing artists, and poets. The poetry also will be very nice poetry. They write. Okay. Next. It is the chronic of Ignatia and Bryonia. It is the chronic of Ignatia and Bryonia. So after giving Bryonia, if the symptoms are recurring, you can go for Netramure. And Ignatia is having this grief, latest grief. Recently, he lost business or some near and dear. Netramure is chronic of Ignatia means last term 5 years back, 10 years back, still feeling bad. We can go for Netramure. It is the chronic. Next. Muscles tremble, shiver. inability to keep the limbs, still, still. So always he will be jerking either hand or leg or something like this, tremors. Natremir is a symptom. That is a natremir symptom. Okay. Eats well, EATS, eats well, but still emaciation. That is very lean and does not take the body will not absorb the food. That is called emaciation. But he eats well. And emaciation mostly neck. Neck is smaller. Emaciation mostly in the neck. Next. School girls headache. It's a peculiar symptom of natremir. School girls headache. Why headache comes for school girls? Because of this extra activities of worrying about others, imaginations, so much weak memory, all those things that bring headache. So they are poor in mathematics, poor in memory, all these things put together. School girls headache. When you ask the girl to go to college or school, she says, headache, I cannot go, like that. Give natremil 31 or 2 doses, then she'll be okay. Next. Itching and eruptions. Itching and eruptions on the margins of hair margins, they will have itching and eruptions. 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 Next. Loss of taste. They lose the taste. The tongue will not enjoy the taste of the food. Loss of taste. Next. Unquenchable thirst. UNQUENCHABLE. Unquenchable thirst. They will be drinking so much water, but thirst is not satiated. They are not satisfied. That is called unquenchable thirst. Pneumonia is there, nitrogen peroxide. Unquenchable thirst. Next. Easily takes on cold. They get this cold very easily. Easily takes on cold. And thirst, THIRST. THIRST thirst. Easily takes on cold and cold during summer. It's a very good medicine for cold during summer. Next. Cannot walk much. They cannot walk much. Feels some obstruction in the throat. I told you that urgent nitric. Urgent nitric is there, heparsol is there, and also in nitric. Walk, WALK. WALK, cannot walk. ज़्यादा पैदल नहीं जा सकते. Next. Cannot pass urine in the presence of others. This is the peculiar symptom of natremir. You will ask me how we pass urine in presence of others. Only this is applicable for patients, bedridden patients. They will put bed pan, that urine, this one they will put. But they cannot pass if somebody is present. They will ask the nurse or compounder to go out. Then only they can pass it. This is a peculiar symptom of network. Next. Menses too scanty. Menses scanty. SCANTY. Scanty means less. LESS. Scanty or less. That means bleeding is very less. And in some cases, too profuse. In some cases, it is scanty. In some cases, it is too P/O2 profuse. PROFUSE. Profuse means more. So network has both the things. It can be scanty or it can be profuse, or both. Network is a very good. This is one of the life-saving medicine for sunstroke. One of the life-saving medicine for sunstroke. Sunstroke spelling is SUN sunstroke, not SON sunstroke. SON sunstroke, there are other medicines out there. But this is SUN, heart. Okay. Life-saving medicine, MEDICINE, medicine spelling. MEDICINE. Okay. Next. Best remedy for anemia. Anemia, I told you, bloodlessness. Hemoglobin is less. Natriuretic patients, blood will be less. It is a very deep and long-acting medicine. It is a very deep and long-acting medicine. This works very deep in the person. So we should not give too many doses. But the patient needs treatment for years together. He may require medicine for years together. Okay. Next. The symptoms have a slow beginning. The symptoms have a slow beginning, long lasting, and deep seated. Slow beginning, long lasting, and deep seated. Very deeply, the problems will be there for a long time. Okay. Next. Craving for salt. Very important point. VIP. Craving for salt. Salt is in the cooking, salt is sufficient for everybody in the house. But for them, extra salt is required. Those who take extra salt, for them, natriuretic is a very good remedy. They will stop taking more salt. Next. Drinks large quantities of water, like bryonia. These people also will have dryness of the mouth. Drinks large quantities of water. Next. Ravenous hunger. RAVENOUS. RAVENOUS. Ravenous hunger. That means, in bracket, you note down. they take more quantities of food. Hunger is not satiated by taking small food. So they take more food. It is called ravenous hunger. Next. Aversion to bread, BREAD. Aversion to bread, comma, fat and rich food. Aversion to bread, fat and rich food. So they can't digest rich food. So they don't like to take. Next. Symptoms aggravate. Symptoms aggravate. 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 In warm room, comma, music, comma, lying on left side, ringing of a bell, noise, SLAMMING. Door they have put it shutting on them. That sound disturbs them. Okay. Next. Headache or other symptoms aggravate. In the morning, moves along with the sun, SUN, moves along with the sun, and better after sunset. Better after sunset. Symptoms aggravate during full moon and touch of others. They don't want to be touched. Sensitive. Next. Symptoms are better in the open air, lying, LYING, lying on hard surface, tight clothing, and cold water. Next. Netramure is made up by disappointment, failure in love or business, losing near and dear, comma, fear, quinine, 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 fatty food, FATTY, bread, and excessive salt. Excessive salt. Next, more Netramure patients can be found in malarial regions, and excessive intake of malarial drugs. Children are late in learning to talk. Some children start talking after 2 years or 3 years. If other symptoms tally, this is one of the best medicines. Late in learning to talk. Next, very frequently used and important remedy of homeopathy. Very frequently used and important remedy of homeopathy. So this is the Netramure. Generally, we will find Netramure in business failures, love affair failures, or the girl in love with boy or boy in love with girl, unable to forget them, then they will be just thinking about them, imagining them. I gave one case to a student who is in a degree, fell in love with another girl, and that girl got married. This fellow has become mad or almost insanity. Stopped studying. Father came worrying. He's in a B pharmacy education second year. Then I gave the medicine. He has finished his M pharmacy and also PhD, got married, now have 2 children. That day, if we don't give that medicine, he will become mad, or he may commit suicide, or he may go for arum metallicum, we may have to give. This is a wonderful remedy for life effects, failures in business, and other situations. So that's all. This is Netramule. And now the forum is open to Sri J.V.V. Satyanarayana Garu for conducting the QA, question answer session. Thank you all for your patient listen. Today I am very slow intentionally. Okay. Thank you. Is the class okay?
Yeah, Uncle. So today Satyanarayana sir is not there, so I am taking the question and answer.
Umesh, sir.
Yeah.
Well, thank you, Umesh, for making the Telegram app. Today date you put it.
No problem. Manjunath from Mysore, sir. Manjunath, sir.
Yeah. Anjunath from Mysore. So raise the hands, please unmute.
Okay, any other questions? Okay,
Yes, sir.
Rakesh Kumar.
Yeah. Sir, you said children are late in learning to talk, NM children. So for such child, if you give NM, will they start talking early?
They will start. I gave to some people. They started talking. Other symptoms. Okay. Shravani.
Good evening, Master. Adi Natramore can be developed over a period, means a Natramore constitution or a for a person, means due to their life situations or something or something. Hello.
Yes.
Means so over a period of time they can become natramore unknowingly. Okay. Okay, Master. That was my.
Rakesh Kumar, sir.
Rakesh Kumar is allowed to ask.
Sir, namaste. Sir, are you getting me?
Uncle, your voice is breaking.
Sir, am I audible to you?
Yeah.
Yes.
Sir, my question is that can natriumur be used for depression or some very old cases who have underwent some trauma-like thing and unable to forget that thing?
That can be cured with natramur.
Uncle, your voice is low. Can you be?
Cured with natramur.
I couldn't hear, sir.
This can be handled by natramur.
Okay, thank you, sir. Can be handled with natramur. I got it. Thank you, sir.
Sudharani Khatri, madam.
Yes, sir. This is Sudha from Karnool, sir. So we are taking salt at least, 2.5 grams max per day, no, sir. So every day we are taking, don't we become the provers of natramur
No,
for that quantity?
no, it won't. You should
Okay.
on it. Then you
Uncle, your
Okay.
voice is breaking.
Again, it's breaking.
No,
See.
no.
if you use it in, but if you take everyday raw salt on the tongue, you will get the province. Is it okay?
No, you
Yeah,
have to repeat the
but
answer.
still, yeah, sir.
Raw salt every day for a few months, you will have natramur symptoms as a proven. But if you put it in cooking, you won't get province.
One more question, sir. Natramur is made up by disappointment, losing near and dear. Fear, quinine, you said, no, sir. Is that the medicine of malaria?
Quinine is the medicine for
Yeah. That's why you said, no, sir. More Natramur patients can be found in malarial regions. Yeah, I got it, sir. Thank you so much, sir.
Venu Madhav, sir.
Sir, namaste, sir. I'm from Guntur. Sir, you said so some limited quantity, 2.5 grams per day. So, what if we completely avoid salt? So, does that make us, lack of
completely salt. Your body will be dehydrated.
dehydrated? Okay,
Why? To maintain the quantity of in the body.
okay,
Totally avoid it. As told by Mantana Satyanarayana or others, salt cannot be avoided 100%. But
okay,
available in the vegetables.
okay,
Vegetables have salt in them.
okay,
Enough. That is what Satyanarayana says. In addition to that, we take salt. Animals don't take salt.
yes, sir.
They get from the grass or the vegetables they get.
Okay,
Salt, whatever we are using in the kitchen, is for the tongue.
okay,
People who add salt, there are some people who want more salt. Very this
oh,
other things. In course of time, they will get a lot of symptoms.
okay,
They should always be in moderate quantities.
okay,
Without salt also we can have, if you take vegetables with the salt. Many vegetables have
okay. Sir, I have one more doubt. Sir, you have said itching and eruptions on the margins of hair. So, do you mean on the edges of the hair or at the root of the hair? Edges. Okay.
roots.
Sir, can you repeat again? Your voice is lost. Edges. Okay. Okay. Thank you, sir.
Any others have questions?
Yes.
Padma Rekha, madam.
No class. Tomorrow there will be.
Sir, Padma Rekha, madam.
Sir, one lady is there, sir. She will be, she has got low married. All the time she have a trouble with some things.
You have to see other symptoms.
Okay, sir. Thank you, sir.
Next. Okay, note is there. Close the session.
Rakesh Kumar again.
Sir, with your kind permission, I wanted to add few things to Natremure. Sir, animals do not need taking the salt because their edibles, this grass and all, it comes directly from the earth, the soil, and not it is not even processed. Also, they do not take the cooked things. We take the things which are grown from the soil, we cook them and use them. That is why we need another salt. Also, the property of the salt is hygroscopic. This absorbs the water. So, water retentivity in the body is maintained by the salt. Is it correct, sir?
Correct, sir.
Thank you so much, sir.
Right. Okay. So,
Any other?
let's close the session.
Yeah.
Tomorrow is the seniors class. Friday, no class. Again, next Wednesday, we'll meet for juniors. Thank you.
Thank you,
Thank
sir.
you,
Good
sir. Good night, sir.
Thank you all.